Hello, my name is David Halsey. I'm an orthopedic surgeon at the University of Vermont Medical Center Orthopedic and Rehabilitation Center. Welcome to this segment on the hip and knee arthritis care team at the University of Vermont Medical Center. I thought it would be helpful for you to have a little bit of information about who you're going to be seeing and the experience base that we have to support you in your needs. So annually here at the University of Vermont Medical Center in Burlington, we perform upwards of 900 hip and knee replacements per year. We have 3 board-certified and fellowship-trained arthroplasty surgeons, supported by a great nursing team, nurse practitioners, and physician's assistants, along with our office staff of nurses, medical assistants, and front office people. We're very lucky to have a great center where we can bring all of this talent together to meet your needs. Over at the hospital, we have 3 dedicated high-efficiency operating room suites with, again, dedicated nursing units and surgical care teams. But it takes a lot more than that to make sure our complicated patients have a smooth course through their surgical experience, and so we have all of the experts available in advanced hospital-based medicine, infectious disease, rehabilitation, right alongside as part of your care team. Physical therapy, occupational therapy, and restorative therapy services are also available for the acute post-op recovery. Let's talk a little bit about sort of the typical roadmap for having a hip or knee replacement here in Burlington. Well, you come in the day of surgery, you have your anesthetic, the surgical procedure, and you move to the recovery room. Later on that day, for many of our patients, we try to get you up and out of bed, at least to a chair, so that you begin to start the recovery from the anesthetic and getting back to being a little more normal. By the morning of the first day after surgery, we'll begin your rehabilitation with physical therapy and nursing support. And if pain control is great and you feel comfortable, certainly after some of our hip replacement procedures, you can even go home that first day. At the moment, most of our patients are staying in the hospital a second night for the more complex hip and knee surgery, and our younger patients are ready to go in the morning and later on in the day for our middle-aged or older patients. Just about everybody who has hip or knee replacement is ready to leave the acute care hospital setting by the 3rd day. Some patients will go directly to home. That's probably 8 out of 10 patients will be able to go directly to home, and we make those arrangements working with you and your family before the surgery date, of course. Some patients will need more assistance at either a skilled nursing facility or the acute rehabilitation, high-level rehabilitation center at the Fanny Allen in Colchester. So what can you expect? Let's talk about the milestones. The typical things that patients are interested in is, when can I start walking again after this procedure? Well, as I think you see from our pathway, you'll be up and walking with support for your protection the very first day after surgery. And it's quite patient-specific. You may be able to get up and around with just a cane. You might be better with crutches, and some of our patients would even use a walker at first. Whatever you need to get up and safely start your recovery. But you can expect to be walking without any assistive device, no walker, crutches, or cane, by 3 to 4 weeks after your hip surgery. And similarly, after your knee replacement surgery. Another frequent question is driving. Well, for all of us here at the Orthopedic Specialty Center, we think that the most important way to answer that question is when you feel safe. So after a couple of weeks of healing, you're probably ready to start thinking about returning to driving. But it really has to be on you. It's when you feel you're a safe, responsible driver. And that varies for everybody. How about returning to work? Well, it depends on your job. If you have a sit-down job, many patients are able to return to work within 2 to 4 weeks after their hip or knee replacement. But if you have a manual laboring job, either indoors or outdoors, working in the woods, it's going to take longer to get you fully ready and fit to do that work. So again, return to work is individualized for each patient. And finally, how about returning to the things I really love to do? I like to hike, I want to ski, I want to begin to play tennis again. Well, that's variable over time, but in general, by 8 to 12 weeks, you've got enough strength and balance to return to simple recreational activities, and by 4 to 6 months, to pretty much everything you're hoping to do within reason. Let's talk a little bit about some of the unique aspects of the joint replacement program here at the University of Vermont Medical Center in Burlington. Our philosophy is to use tried and true implants, implants that have a long track record in patients without problems of early failure or recall. So our philosophy is use tried and true implants, but use technology to make sure they're put in the best way possible, to leverage the decades-long skill of your surgeon with high-level technology to make sure the surgery goes as smoothly as it can, and most importantly, allows you the most durable hip replacement or knee replacement possible. So there are a lot of things to consider there, and we'll look at each one of these briefly. So just like everything else in life, technology gets better and better. So the materials that we use for hip and knee replacement have improved over the years, and quite dramatically over the last 5 or 10. Patient-specific instruments. So for selected patients here, we'll use custom-made instruments based on preoperative X-ray and MRI or CAT scan to manufacture the actual cutting blocks or jigs that are used for knee replacement. This allows the procedure to be less invasive, hopefully less blood loss. Usually we see quite a difference in blood loss when we use these, and less overall time for the procedure. Another question we get a lot is, well, what about having custom-made implants? Well, at this point, I think we're just beginning to learn about custom implants. They're a little more expensive to manufacture, and they have not yet proven any long-term benefit. So I think time will tell on that one. I also think that for your surgeon to be able to do the best job for you, we need lots of flexibility in the operating room to get the best joint replacement we can. And when we have a full set of traditional high-performance implants with high technology to help us put them in, our philosophy is that's the best combination for you today. There are a number of things we're doing here at the University of Vermont to improve your outcome. They include helping you with the decision-making about surgery. You'll hear those words called shared decision-making. There are options of minimally invasive surgery based on your particular situation. And we'll talk about those in the office as we have our consultation. Another strategy for improved outcome here at the University of Vermont Medical Center includes infection prevention. An infection around the time of your total hip or total knee replacement is a really devastating complication. And so we spend more time trying to make sure that you're in as good health as you can before the procedure. The processes in the hospital are as safe and sound as they can be. And as a result of this effort over the last 8 or 10 years, we now have one of the lowest infection rates of any academic medical center in the country. Now, we have to keep a sharp eye on this every day, but at the University of Vermont, this is a priority for you and for us. Blood clot prevention and using strategies that are safe and decrease the risk of complications are a fundamental part of our preoperative planning for you as well. And we also use a standardized, forward-thinking rehabilitation program with our physical therapy colleagues both in the hospital and at the Orthopedic and Rehabilitation Center to guide you through your recovery. A little more about the shared decision-making process. The American Academy of Orthopedic Surgeons has a website dedicated to helping you get the information you need to make a choice regarding hip or knee replacement surgery that best fits your preferences and needs. The website shown here will show you how to get there, and if you have any questions about it, we're always available here in the office to help you out. I spoke a little bit about joint care processes, but these include a comprehensive preoperative medical assessment with your primary care doctor to make sure any reversible medical risks are addressed fully prior to your elective joint replacement surgery. It includes excellent control of your blood sugar if you have diabetes. It includes screening for infection that you may have and colonization in your nose actually, which is an area that's associated with subsequent infection, so we screen and treat for that as appropriate. And finally, good dental care is a really important part of maintaining your healthy body and a safe joint replacement. So we'll screen all of our patients before surgery for their dental hygiene and have a good cleaning before the procedure, and then care of your oral cavity and your teeth and your gums lifelong are a very important part of living safely with your joint replacement. And finally, we focus on a team approach here using all of the specialty services that are available at the medical center. This includes an acute pain service with our anesthesia colleagues using advancements in nerve block and medication to help you mobilize safely and more comfortably after your joint replacement. We use a multimodal pain management using 5 different classes of medicines, trying to avoid using the strong narcotic pills and their side effects. And by working together with our colleagues and advancements with the pharmacist, we've been able to have much improved pain control and earlier recovery. We also take care of a number of patients who have lots of other health concerns that compound or confound their surgical risks. So at times we'll enlist the help of our inpatient hospitalist service, internal medicine specialists in the perioperative care for patients. I think this is a really important nuance or option for our patients here at the medical center that you can't actually have available to you in some of our great smaller community hospitals. And finally, because we're an academic medical center, there is full-time medical physician support in hospital 24 hours a day to meet your needs during your hospital stay. So I hope you've enjoyed this brief segment on the Orthopedic and Rehabilitation Center Hip and Knee Replacement Program here at the University of Vermont Medical Center. If you need more information, you can reach us at the office or use the University of Vermont Medical Center orthopedic website.